Hello, everyone, and welcome for today's webinar session this evening. I want to give you a very warm welcome to our 6th webinar in our brand new practitioner series, and today's topic is all about children's nutrition. Now, my name's Ella, and I'm the practitioner lead here at DR.VEGAN, and we also have with us today our fabulous guest Zakia Mance, who's a naturopath specialising in children's and pregnancy nutrition. And she's also a hypnobirthing practitioner and a doula as well. So very interesting guest we have on today. Now, before I start, I quickly wanted to mention that our practitioner webinars are intended only for practitioners. And of course, this includes trainee nutritionists, nutritional therapy practitioners, dietitians, naturopaths and pharmacists. They're not intended for members of the public. So I just wanted to put that out there. So professionals and students only. So to start, I wanted to give you a very brief introduction to myself and Zakia. Firstly, I've got a passion for practitioner education, and I've previously worked in lecturing and clinical supervisor role at one of the major nutritional therapy training institutes, and have since put my passion for education into training practitioners at DR.VEGAN and creating materials to make clinic much more efficient. We're also thrilled to welcome today Zakia Mance, who's a children's and pregnancy naturopath. So Zakia, do you want to tell us a little bit about yourself?
Oh, I'd love to. So hello, everybody. I'm really pleased to be here this evening and talk about what passionate me the most, which is children's health and mother's health as well, but it starts with children. So yeah, I'm a naturopath. I think I've always been a naturopath. I saw naturopaths when I was very, very young, and then I made it my passion and my work. So I do, clinical work. I support women in pregnancy, and I was also the president of the British Naturopathic Association for 3 years, and was part of the naturopathic profession for about 7 years. So yeah, very happy to be here this evening and share with you some of the knowledge I've accrued over the years.
Fabulous. Well, we're very honoured to have you on today, Zakia.
Thank you.
Now, before we start, I just wanted to add to everyone out there, please feel free to ask any questions that you have along the way. We are going to have a short question and answer session at the end, where we will be answering your questions. And we probably only have time to go for a few questions at the end. So if yours doesn't get answered, or if there's a question that you don't feel comfortable asking on here, please do reach out to myself and I'll be able to help. And of course, I'll be showing my email address at the end. So without further ado, let's get started. Okay, so today we will be covering a few topics, including children's nutrition statistics, how to ensure a child is getting all of the nutrition they need, what to do about fussy children, the public health burden of ultra-processed foods, and nutrient requirements for that are specific to children. We're also going to take a dive into supplementing children and how that differs from supplementing adults, and how to meet a child's nutrition intake on restricted diets. And of course, we've got a question and answer session at the end. Okay, so before I get started, I wanted to share a few statistics with you, some of which are a little shocking. So from the years 2022 to 2023, among reception-aged children, which is aged 4 to 5, 9.6% were classified as obese and 12.4% were overweight. Among year 6 children, that's children aged 10 to 11, 22.1% were obese and 13.8% were overweight. So that's really quite shocking statistics. Before children even reach adulthood, their health is starting to suffer from diet. And obviously it's a combination of diet and exercise, but the majority of obesity and being overweight is down to diet. Okay, so a study of toddler diets found that 61% of toddlers' energy comes from ultra-processed food, leading to concerns about dental health, poor nutrition, and behaviour issues. I mean, that's a staggering statistic, 61% of toddlers. And quite frankly, that's very, very sad. But, you know, it can be very difficult as parents. You know, quite often mothers have to work. Both parents have to work these day and age. Let's be a bit politically correct there. Mothers and fathers need to work. And time with children can be an issue. So I suppose it's kind of that thing that you rely on. You go to the pouches or to the jars of baby foods or the ultra processed foods to keep them happy or to keep them quiet. So it is kind of sad, but unfortunately that is the reality. Okay, so a University of Leeds review found that 41% of baby foods sold in the UK have excessive sugar, with some products deriving up to 60 to 70% of calories from sugar. And also they have poor nutritional quality despite being marketed for infants. Now, I don't know if anyone saw the news recently or the news articles online about some quite major brands of baby foods that are claiming to be healthy or pure or natural. And actually, they have staggering amounts of sugar in them. And it leads to an intake of sugar that's much more recommended for people and babies. So again, that's really quite a shocking statistic to see there.
And also, Ella, I'll just jump on that because I think on the 20th of this month, the Department of Health has literally summoned most of the big companies, baby food companies, or manufacturers of food for children. And they've got about 18 months to change or reduce some of the sugar and salt in the food they produce. I mean, this has, I think I put the date, and this is for babies up to 36 months. So obviously the government is also seeing the amount of damage it's doing to our children and little ones. I mean, another figure, 11.4 billion a year, that's the cost of obesity for the NHS.
Yeah.
So, and I think what's quite interesting, and I'll just stop there, but what's interesting is year after year, we've seen the government trying to tackle this problem with, food manufacturers, but it doesn't seem to get any better. And those statistics actually show it's getting worse.
Absolutely. It's so sad, isn't it? But I'm so glad that the government actually, setting some regulations around the amount of sugar that can go into baby foods and, the amount of processing. So I'm really glad that is happening, although it is a bit sad. It's going to take 18 months to
or they are given 18 months.
Yeah. Okay, so with all those shocking statistics, I'm sure you're all wondering what we can do as professionals. So I'm going to hand over to Zakia now, who will take a deep dive into children's nutrition. So Zakia, over to you. I'm actually really excited to hear what you've got to say today.
Yeah, could I just ask you if the slide could be slightly bigger? If I don't know if our...
No, I think it's because you're on the host end. I think everyone else can see it full screen.
Perfect.
Sorry about that.
No, that's okay. So what I like to always say to my patients or clients is eating is not just about what we take in as fuel. Eating is also, what we eat, when we eat it, and how we eat it. And when I say how, it's in what environment we eat it. So it's a big part of our cultural development. And I know, as you said, lots of mothers and, or parents, are working these days, so they can't do what they would like to do precisely. But by trying to educate them on seeing the bigger picture, so it's not just, are they eating, is my child eating enough, I don't know, carbs or the right things. It's also, how do we do that on a daily basis, making the right choices in the long term. I'll just get my screen slightly closer, maybe, if that's okay. Sorry about that. Oh, there we go. Can you see? Is that still okay?
Yeah, I can see. No problem.
So next slide, please. Or next. So when I say it reflects our ancestral heritage, genetic predispositions, cultural norms, early maternal care, and social standing, for me, that's a really, really important one, because the way our mothers fed us when we were in the womb is really important, because that's our first link to nutrition and how we develop our first preferences, but also how we deal with food in the most basic way. Now, if you grow up somewhere in Africa where maybe you wouldn't eat certain foods, regularly, or if you grew up in India or Manchester, for example, your entire system, your DNA would be very different. And that's also what I take into consideration when I have patients that have different genetic backgrounds, because that's also quite important. So next slide, please. And we do have medical literature also that confirms that whatever the mother is eating for the first 9 months and before has huge impact on the child development. Again, not just on the quality of the nutrition, but also how the mother is eating those type of foods. So is the mother stressed? Is the mother eating in an emotionally supportive environment? All these things have an impact on the child, and also how we develop patterns of eating later on. And that's really, really important. On a most basic level, if the nutritional input is not there, of course, it will have an impact on the child's development. And we see that with, brain development, with cognitive functions later on. But it's bigger than that. And I think I've put some links. Seeing how children develop emotionally, not just physically, we can see the links with how mothers have been fed, nurtured, and supported during pregnancy. So next slide. So it's essential to recognize that eating is at its core an act of pleasure, because what I also see in clinic quite a lot is maybe parents, and I think, Ella, you're absolutely right when you say we are so stressed these days as parents. We are so worried. We tend to have a very, almost a transactional approach to food with our children. So do they have enough of this? It's very almost robotic, or where it all starts with pleasure. Let's cook together. What do we want to eat? It might not be the healthiest or the most optimum food maybe for dinner, but let's have pleasure. Let's be happy. Because the link with stress, eating, we know if we're in a fight or flight mode, we don't produce all the hormones, the enzymes we need to digest our food. I think we've all been in a situation where, you're at work, you're super stressed, you have your lunch, and it sits in your tummy because you haven't digested it properly because of the stress hormones. So with children, it's really important to create a routine where, if you can, and that's not always easy, you eat together, maybe you prepare the food together, because that's also that's how children start, loving food. What is it? What do we eat this? They ask questions. Touching food, cutting, they are very good at getting involved. But if we do that together, then they are less likely to have problems later on. And I think we'll look at that in slide 10, I think, about, fussy eaters. But if we create an environment where we explain why maybe in certain household we eat more of certain foods than others, then it creates curiosity, it creates pleasure, it creates an openness to food, which will make it easier for them to overcome the problems they might have with food later on. Next slide. So how to ensure a child is getting all of the nutrition needed? So as I said, for me, when I see clients, and obviously they come with their parents because they're usually between 0 and 10, 0 and 12, my first question goes to the child. So I obviously, talk to the parents, beforehand, so I know more or less what the problem is. But what I like doing is sitting with the child and asking questions, very basic questions, because if they have issues with getting enough nutrition, and that could be for many reasons, and some of these, I've outlined there. So allergies or intolerances, for example. Well, allergies are quite easy. They might go to doctors and said, I'm allergic to whatever. So it's pretty easy. Peanuts or eggs or fish. Or intolerances are a little bit more difficult. So by also talking to the child, you get them involved, and they might be very small, very good at saying, when I eat something, for example, when I eat, I don't know, strawberries, or when I eat, I don't know, chocolate, or I don't feel well, or I get these symptoms, or and they might tell me things that they won't tell their parents because they might not remember, for example. So it's really good to question not in a what's the word, in a more inquisitive way, trying to know them, because once we know more about the children, their symptoms, how they feel, that's how we can help them the most and get to the to the goals we have for them. So it's not one size doesn't fit all. And I know there are lots of maybe, I don't know, articles or says, take this, do that. I've seen many children where they have followed, their parents have followed all the guidelines, given elsewhere, and it doesn't work. And for me, it's, why is it? It could also be sometimes maybe problems with, mental health issues, mental health challenges. Maybe the child is not talking to the parents. Maybe at school they are bullied, or a simple one I had, recently. So this little girl had constipation problems. And I know the parents, the mother is very good. The diet is excellent. They are in a loving family. But the child didn't tell the mother that at school she didn't want to go to the loo. So she didn't poo, basically, because there are boys around and they are boisterous and they look at the girls, in the toilets anyway. So she was constipated for a long time, but she didn't tell her mother. So it could be as simple as that. It could be medical conditions, and that's the first one I would check with the parents, because for me that's the most important one. When there is an issue with a child, is it something that needs, not urgent, but do they need to maybe to see the GP? Because, Ella, we were saying that it's all about the child's, health. So, what is it? Is it important? So in that case, I would say, please go back to your GP. I might talk to the GP if I have the details and say, I've had this, this patient here, and this is what I think maybe, we need to do more tests or something a little bit more, there might be something more sinister. So let's do all the tests possible to rule out anything serious. And then we can delve into the more, maybe in more details and going into something that's not as maybe life-threatening or dangerous. And also, just in case anything happens later on, then at least I've done my due diligence, and we've contacted them, the right people. Other problems, there might be emotional stress or trauma, and that's why I also mentioned at some point working with therapists, working with psychologists, working with if there are any school psychologists, it's really, really important, because sometimes it's not physical. As I said before, it could be, mental health issues or psychological issues. So that can have impact on the physical side. One of the last ones, there could also be digestive gut health, which, as we know now, the brain-gut axis, I mean, we hear it everywhere. It's, one of the most important one. But, the intestine or the gut is the second brain. We know that now. So if the gut is unhappy, and the liver as well, I mean, they work, hand in hand, then nothing else, can absorb properly. They can have a leaky gut, which can also lead to, high histamine or reaction to certain foods. So dealing with the gut first, it's one of my, maybe after ruling out any problems, any health issues, it's maybe one of the most important one, because we know immunity starts in the gut. There are some amazing people out there who do work on ADHD and other medical conditions like that. And the link now is very well researched. We know that if the gut is not happy and impaired, then there will be problems like ADHD or also autism. So dealing with the gut, making sure they are eating the right things, they are absorbing also what they are eating, and the supplements they are taking is super important. And then the last one, which also links with, I was talking about ADHD, and it's sensory processing difficulties. So for children who have or overreact, underreact to external input, it might be quite difficult. So let's say they are eating outside or at school, and it could be noises, for example. So they respond really, really strongly to noises, to taste sometimes, or smell. So let's say if you give them broccoli, which for some children is absolutely evil, they might not eat certain foods. They might think fish is too strong, or eggs, for example. And again, science has been amazing lately. We've discovered that with certain children, and I'll find you the link again, with certain children, if they have an impaired gut, then they will taste those green vegetables much more strongly in their mouth than children who don't, which I think it's extraordinary. So when they say these vegetables are yucky, for them they are, because the way they taste them is different from other children. It could be touching certain food. If it's too crunchy or too mushy, they might not like it. So all these things at the end, make these children very difficult to please food-wise, because they become very restricted in what the parents can give them. Yeah. Next slide, please. So these are my motto. Keep it simple. I think when you've got children who either have difficulties eating what you're giving them, or just simply nutritious food or healthy food, whether at home or at school, I don't like making it too complicated for parents. Usually when parents come and see me or other practitioners, it's because they are either desperate or they don't know what to do. They've tried everything, or they've tried different things, and it's really, really difficult. So reassuring and saying, we'll start slowly but surely. So just saying, this is what we start first with, and then we'll carry on. Almost having a plan in your head, but not overloading them with information or science or data. Some parents do want that, but what they want is almost reestablishing that connection with their child and stopping the battles. That's what I hear the most. It's a battle. Dinner is a battle. Lunch is a battle. Going out, to restaurant is a battle because my child doesn't eat, or they don't want to sit at the table, or I don't want to cook anymore. And it's trying to, in the first instance, almost calming the parents, so they are able then to support the child in a more emotionally contained way. Next slide. So as I said, parents are often always overwhelmed. So with information, especially on social media. One of the tips I also give to the parents I see is choose 3 sources. DR.VEGAN website, for example, for the articles and the supplements. Maybe a government-led website. So for example, if you are vegan, and I've put some links at the end, PETA for Kids, for example, that's a great website. Trusted sources of information that detail clearly what to do, how to do it, and when. So really keeping it simple. Social media is great, but if it's too much and you can have contradicting information, it can be really, really difficult. We are all here, practitioners and professionals, so we know where to look and how to find out what's the best information. But for parents, it's a minefield and it's really difficult. So I say 3 sources of information, keep it simple, and that's it, because otherwise it's not going to work. So having them reassured and heard, and that's again something else I hear a lot, is parents saying, I went to my GP, I went to that person, I've tried this, I've tried that, and nobody listens, or nobody trusts my child when they say, I've got this, for example, I've got this condition, and so listening to them, not making any assumptions, and not jumping onto a diagnosis straight away, because sometimes it's not as easy as it seems. Next slide. So we are here to educate. We are educators. We are not here to overload. We might have 100% of the information. They might need 1%. And if they only go home with 1% of the information, or 5%, and practice that and teach that to their children, I think it's amazing. We've done something amazing. So just focus on why nutrition matters in a clear and relatable way. I might not explain the same way, why nutrition matters to a young couple, for example. They are very busy, they haven't got the time. So I might be very matter of fact. bullet points. If it's a mother that comes alone with her child and she's very anxious, I might talk to her more. I might be more available on the phone. So you really have to bespoke how you deal with different types of individuals as well. Try as much as you can to empower both parents, because if it's only the mother, and that's what I see in my practice, I'm sure, I don't know if it's the same for you, but, that's what I see. Most mothers will come with their children, but try to get the dad as well, because let's say the mother is not around, she's the one who does 90% of the, the protocols. But when she's not around, dad thinks, well, it's mommy who does that. And they really need to be both on the same page, especially when they are quite strict changes, for example. You need everyone on board. And when the child sees that, they are much more likely to comply and think, this is a family issue. We are all on the same page. That's how I'm going to get better. And include the child. I mean, we think, they are too small to understand, or they do. When you sit with them, and that's why I love what I do, you sit with those children, you say, this is what we are going to do because you have this and that, your poo is not great, and that's what we're going to do, and it's going to change. And I show them pictures, and they're amazing. They absorb the information, and they know they are going to get better. They know what's wrong with them. So include them. And if there is something that's maybe more difficult, or talk to the parents on the side, but include everybody so that everybody feels heard, feels engaged, and is on board as well. And so be also mindful of parents' lifestyle. I mean, that's the other thing I hear quite a lot. Parents coming with pages and pages of protocol, and they say, I can't do this. I haven't got the time to, I don't know, plant my own vegetables, just because they'll be organic, or, there is always the optimum way of doing something and what people can do. We have to meet them halfway. And if they can't do something, let's say, okay, well, you can't do that, but what else can you do? So it's also about not trying to overwhelm them, because I think, if you try to overwhelm them, then they won't do anything, and that's not going to help the child. So, yeah. Next slide. So follow-ups and encouragements are really, really important. So first of all, when everyone is busy, we do everything so fast, everything is so quick. When I see the parents and the children, I said, this is going to be a long process. The getting better might not, but this is a long process, because we lay the foundations, we understand each other, and the better we do that, the better the healing and the results. So once the foundations are in place, keeping also a link with the parents and with the child, so they know they are not on their own. If there is a problem, we're always here, but not creating, again, an extra pressure for them to fulfill, I don't know, some data, some charts, or once that's done, 2-3 months, and we can see improvements. The dynamic has also changed between the parents and the child. Then we can be a little bit more maybe detailed, maybe give more information, charts, or whatever their goals are, but not in the first maybe couple of sessions, 2, 3, 4 sessions. But I usually give 3 months. It also gives them the headspace to think, okay, like everything else in life, you need to dedicate time, energy, headspace as well. So it gives the parents a good idea, where they will be at in 3 months. Next slide. The other thing we could do, which I think it's also a good way, mostly for parents, it's having either blood tests or other tests. And I know, I won't go into details, but I can send maybe some names or some brands of labs if people are interested. But I like to keep things simple. Most of all, because loads of tests out there are very expensive now, and a lot of parents, especially since COVID, have said to me, I can't afford the test, a gut or whatever, plus the supplements, maybe plus, other things. So there is that. There is one test I do, which is a hair analysis, which gives a far more in-depth, and also it looks at how, at a cellular level, that person, that child is functioning. So I have, a broader picture where a blood test will give you whatever is happening in the body at that specific time, which is amazing if there is something serious, of course, or if we want to test, vitamin D level, for example, or any other urgent indicators. But most of the time, that's what I would go for, hair analysis. But working with their GP is really important, because if they have a good relationship with their GP or consultant or pediatrician or psychologist, because they also feel they have a team that's supporting those parents. So if they insist about blood test, or I think some parents like the tracking. So they say, we came and saw you, last month. That's what was happening. And I say, okay, well, we can do another test, and they can see the improvements. Some parents say, you know what, I can see that my child sleeps better, he's happier, she's not as anxious, and that's enough for them. For some parents, they really need those concrete figures on a piece of paper. So yes, reassuring parents that their efforts are making a difference as well. And also, and I think that's quite good, especially when there are specific problems, B12, for example. So that's really good, because you can see straight away where we need to carry on supporting a specific need, or stop, for example. So yeah, having a team around those parents to also minimize the anxiety. There is so much anxiety and stress, around parents. And this is not just for nutrition, school is starting next week. So having a team that's rooting for them and having, their best interests and their child's best interests at heart, I think that's really, really important. Next slide. So I was mentioning fussy children earlier on. So what to do about fussy children? And I've seen quite a lot. It all starts with parents. 99% of the time, it's parents. And I just want to remind everyone, this is not a judgment. I'm not saying parents are not doing a great job. It's just what I've noticed or what I've seen. And also, once we recognize something, then we can change the pattern. So as parents, we set the trends. And when there are problems with with food, and as we all know, especially around the twos, when children start exerting their powers, which is great, so saying no, for example, that's when usually problems with food start. Taking the emotion out, I say to parents, it's a lot of psychology with the little ones, and that's sometimes having a third person talking to their child and saying, well, we can do things differently. But taking the emotion out, retraining that relationship between the parents and the child, that's really, really important, because the more we get emotional, and I'm not saying it's easy, I've been there, the more entrenched in their in the attitudes they can become. Avoiding bribery and rewards, I really think, again, treating children as children, but saying, if you don't want to eat this, then that's it, and it's not, oh, if you eat this, you can have that, because it's also teaching them, that's my opinion, but, psychologically, it also makes sense. Teaching them eating is for their own good. That's what we want. That's where we want to teaching them, if you eat well, you sleep well, you'll be happier, you can play well, you learn better, so that there is something positive. When we bribe them, we take that responsibility away from them, and also eliminating stress. Children also learn by example. So if they see their parents or their family eating, the wrong food, that's what they will do. Stopping buying the bad stuff. I mean, if I buy biscuits and they're in the house, I eat them all. So I just don't buy them. And it's the same with children. Trying to, and not avoiding everything, because I also think if we do 80-20, most of the time, obviously not when there are allergy issues, intolerances issues, serious cases of ADHD, or not in those cases, but 80% of the time they eat a very nutrition dense diet, then maybe we can make some cakes at home and have them at home, or some dark chocolate, for example. But minimizing the situations where the child will be, or the adult will be tempted by those foods. Encouraging the children to make choices for themselves. And again, that's something that I feel very passionate about. And certain schools like Montessori or Steiner, or they are really for encouraging that independence early on in a nice nurturing environment, but teaching children to make their own choices. So we say, do you want this or that? I mean, obviously you don't give them a pain au chocolat, but an apple or a pear. So they learn, they've got different choices. It's not just one or nothing. And avoiding snacking, because snacking doesn't help the guts to rest, and also for their teeth. It just creates this enzymatic workout permanently in the mouth, and it's not great. So they eat in the morning, they can have a snack maybe at school, they have lunch, and then when they come home, they can have another snack, a healthy snack, and then dinner. So, as I said previously, there are certain cases where the child has ADHD, or I mean, we know now, and there are some studies and evidence that shows with those children with ADHD, because of the dopamine activity and their brains work differently, they need that surge of dopamine, and sugar provides that. So being slightly different with those children, that's a completely different topic, or another topic which we can do another day, but dealing with their blood sugar levels, trying to help with not just, I mean, that's why also these children would want to be on screens all the time, they will really search for the dopamine surge. So maybe not treating those children the same way as you would treat children who don't have ADHD. And obviously in those cases, trying to minimize sugary foods to the maximum, because it's not helping them. So as I said previously, remembering it's almost as much psychology as it is about food, and it really is. And being firm and consistent, as well as introducing as many different foods as early as possible. So being firm and consistent, and I know it's not easy when parents are, super stressed out, they are busy, it's hard. And that's why maybe having somebody else saying, this is what we're going to do, this is what we're going to eat, this is the plan, and we'll stick to it. It's really, really important. If we want our children to stay healthy and be strong, we need to set the boundaries. And of course, avoid ultra-processed foods, which is everywhere these days. Next slide. So as I said before, the public health burden of ultra-processed food is huge. So obesity, 11.4 billion. Again, in the UK, the frequent consumption of ultra-processed food accounts for around 61% of total energy intake for children. I mean, I don't know. It's, as Ella said, it's so sad, but also where are we going with this? I mean, we are looking increasingly more like America, where, there were some, hideous statistics. They're even worse than here. The other concern is, babies' food, as we said before, is super high in sugar and salt, which doesn't help, obviously. And another problem with children is now, since COVID, actually, we've got this trend where children are not ready for school. So they get into school, so 5 or 6, depending on where they are, and they're not toilet trained. Their language is not, what it's supposed to be. There is a huge problem with children having a lot of their teeth removed. There was a very shocking, I think it was Channel 4 documentary, and this was 3-4 years ago. And the lady who operates in, I think she's in the north somewhere in a hospital, and she just takes, children's teeth out because, they are so unhealthy. They just can't, keep them. We are in one of the richest countries in the world, and we see those toddlers having some of them, most of their teeth, removed, which says a lot about what their mothers, have been eating, but also what they are eating. And for me, where have we given up on those people? Because public health wise, what are we not doing to look after those children? Because they are the next generations. Next slide. So this is another sad picture. So the proportion of children exceeding the average consumption and requirements for sugars and salt. It's, yeah, I mean, it's yeah. I don't know. I mean, I have no words, because every time I look at this graph, at this table, it just makes me so sad, because this is not just saying, children have too much of these. It's also all the other implications. They're not learning at school. They have behavioral issues. And we know this now, the studies are out there, too much sugar and too much salt. The other thing is, if they're having too much sugar and salt and saturated fats, then they're obviously not getting enough macronutrients to help them moderate, the problems all these are causing. Next slide. And this is also, the next one is also quite, yeah. So what I found interesting with this table, so the first one, the proportion of breakfast cereals and yogurts marketed to children, categorized as high, medium, and low. So for example, for breakfast, we've done worse. I mean, since 2019, as I can see, we can see that there are more medium. So the medium range is higher. Obviously, the low is almost inexistent now. But what it tells me is, in the past, we had almost a clear indication of what was really bad cereal-wise and what was okay. Now that medium part is almost taking over, which makes it for parents much more difficult to find out, what's good and what's not. So if most of the cereals are medium to high in sugar, for example, they might think, well, that's okay. 80 or 85% or 90% of cereals, of these cereals are here, they must be okay. And that's what most people think, actually. Yogurts, that's slightly better. I mean, we went from 4% to 3%. I mean, slightly better, but still not great. Next slide. So talking about macronutrients and what do children require, because that's also a minefield for parents. So they think, let's just give children a smaller dosage or than what they are taking supplement-wise, for example. It doesn't work like that. So children and adolescents have higher nutrient requirements per kilogram of body weight, obviously, compared to adults, because they are growing more rapidly, developing more rapidly. And the BMR, the basal metabolic rate, is also higher, clearly, because their bodies are doing more things at in a smaller amount of time, and relative to their body size. So they need more energy. But what they need is not more food or more poor quality food. They need more nutrient dense food and supplements when needed. So next, please. So in terms of, and this is also a problem I had quite a lot with parents. If you say to parents, just eat a lot of proteins, for example, with vegetables, they wouldn't know what they are. What are the different food groups? And I think there is a lot out there, but it's so confusing. Parents don't really know. That's why when I say keep it simple, don't say proteins or take macronutrients. Labeling things is quite is good for parents, and telling them that's what you're going to eat, and making it simple, 3 or 4, no more. So the protein and energy needs per kilogram are higher in early childhood and babies, obviously, especially to support cell division and tissue growth. Obviously, adults have a lower per kilogram requirements because we don't grow as quickly. Next, please.
Sorry, just bear with me a second.
That's okay.
There we go.
Yeah, macronutrients. So again, children have proportionally higher needs for those macronutrients. So iron, calcium. I mean, calcium super important because they are growing for their bones. Vitamin D, and now with children not going out as much and taking advantage of the sun or daylight. Vitamin A, vitamin C also super important during their growth phases. And obviously, adolescent girls require more iron because of their menstruation. Boys, need more zinc around adolescence because of their, the sexual, reproduction organs, etc., and sperm. So us adults, we need these nutrients, but obviously relatively lower per body weight, and obviously tailored to maintenance rather than growth. That's why catching those problems early on is really important, because if toddlers or little ones already have deficiencies early on, it's really, really hard. Well, it is possible, but it's more difficult over time to overcome those problems, because it's a whole range of other problems that are linked to those deficiencies. Next. Growth spurts. That's when also children or adolescents, need more, around 12 to 16 years old, because they grow very quickly around that time. And then obviously, it slows down, once they've passed 18, 20, 21. So, yeah, portions and diets. Yeah. So children, that's really important, because I get a lot of parents saying, oh, they don't eat a lot. And then when I look at the portion sizes, I mean, the parents will give, the same portions as they give, an adult. When I was talking about the psychology, children, if they see a big plate of food, it can be quite daunting for them. So they eat smaller portions. It's better to give small quantities and ask them to maybe reserve themselves if they want more food. But again, what they need is nutrient-dense foods. They don't need a lot of food, but what they are eating must be, really nutrient-dense, because what we shouldn't forget is the food we're eating now is also not as nutrient dense as it was 50 years ago. And again, the studies show that. So they almost need more plus supplementation to get to a state of optimal health. Next slide. So again, it's important to emphasize that exposures to different meals may modify and influence a child's future nutritional preferences. Getting them curious about food, I mean, we are so lucky in the UK, and especially, in big cities where we have so many different foods from, different countries, and, you go to, markets and there are foods, from all around the world almost, and children are very curious by nature. So let's introduce them to those foods. They might not like them straight away. Again, there is an amazing charity called First Step Nutrition, and they do an amazing work on child nutrition. They work with the government to make sure, guidelines and what children eat, at schools or nursery is optimum and healthy and has all the requirements, that children need. So there was one study they published, and for children to like a food, and this is not for children, it's everyone, but it's more difficult for children. For them to like one food, you have to introduce it 10 to 15 times. And when I say introduce, it doesn't necessarily mean the child will eat it. It means the child will either touch it, they might squish it, they might smell it, and then maybe after 14 times, they think, ooh, I'll eat that, and I'll start liking it. So like in loads of things in life, it's, you learn. And you learn by being exposed to those things, regularly, to those foods regularly. If we stop giving children the first time they say, I don't want that, I don't like it, they won't get used to those foods, and they won't have a very elaborated palate, because, we have stopped, that discovery. Children's preferences for food are related to their patterns, again, of consumption. If they eat, I don't know, one thing one day, they're not going to like it. So being consistent and bringing those foods regularly. And again, not being too emotional. Oh, what do you mean you don't like it? Or, that's okay. We take it away and we show it again, another day. And that's fine. They are allowed to not like it the first day. We go with the flow. So the introduction of potentially allergenic foods in the second half of the first year of life is important, because that will help with developing food allergies and intolerances. And this also goes for mothers. So obviously, the larger the food a mother eats during pregnancy, that will also have an impact on what the child, would like, and also develop allergy-wise later on. So for the above reasons, just give your children as much as possible, different foods, different tests, so that they can develop, those different, how would I put it, these different relationship with foods, and also developing a strong immune system and a gut flora as well, because the more different foods we eat, and the better for our gut floras. Next.
Perfect. Thank you, Zakia. We do need to bring the presentation to a close very shortly. So we've just go through a few more slides, and then that'll be wonderful. Thank you.
Perfect. So can I use adult supplements and just reduce the dose? No, absolutely not. And well, first of all, ingredient safety, because if you have herbs or adaptogens, for example, they're not tested on children, and they could be very dangerous and unsafe, especially for babies. Obviously, children have different nutritional needs, just because the ratio is different of vitamins and minerals. So that's another reason. The dosage is also different. So children will have different quantities. So, and certain ones, like vitamin A or, too much iron, for example, they can be quite toxic. So you have to be careful about that. Also for safety, because often children's supplements are in chewable or liquid form to make it either easier or safer for them to swallow or to take. So yes, please don't give, just being very, very careful. Next. So any other supplements that should not be given to children? Yes, weight loss or detox supplements, because they can contain laxatives, but they can also be very harmful to the kidneys. CBD supplements, unless doctors, and in some countries, you can, but unless it's medically prescribed, no. Energy drinks, and we know the major problems energy drinks are having in America and here now, so absolutely not. They have too much protein, and creatine are also very bad for the kidneys. And they can also have a lot of hormones or stimulants. So for children, absolutely not. Next slide. So how to meet your child nutrition intake if you're not giving them dairy products, meat products, if they have, for example, allergy, intolerances, or for spiritual or religious reasons. Let's have a look. So let's not forget, and I know there is lots of misconceptions out there, but plant-based diets have been a safe and nutritious practice for thousands of years. And up to a third of the population of India do not eat meat or fish for religious reasons, and those people are healthy. So it can be done if the parents know what they are doing, if they are guided, because the problem is not so much a certain diet, is how you can make it safe and you can consistently adhere to it in a healthy way. So when parents say to me, we want to become vegan, I said, let's start slowly, but also giving them the right resources. So, for example, DR.VEGAN, you have some amazing resources online. That's great. The Vegan Society, they also have recipes. What I think people struggle with is having recipes, becoming vegan. What do I eat when? And the Vegan Society, if you go on the NHS, there are also advice and really good, recipes, and better for kids. Include the kids as well. Ask them to cook if they want to become vegan, for example. That's really, really important. And also bringing supplementation when needed, because I think a lots of children and people have deficiencies. So doing both. It's first the nutrition side and then supplementation. So in this case, vitamin D, B12, of course, and the omegas are the most needed ones. But yeah, as I said before, bringing all this is great, eating well, bringing the supplements, but making sure your gut is absolutely, tip top so they can absorb and not have problems with the leaky gut. Next. Yeah, and then I just put, that's a really good, I give that to lots of children when they come and see me, vegan or not, because, they can also, it's easy, they can see what a healthy plate looks like. And they have, they can have that in the kitchen, and it's, it's easy, especially for the parents as well. So yeah, and I think the last one is also one from the, oh no, that's your lovely product, sorry. But yeah, visually it helps the children the most, but for parents it's, if they have that and they can follow the plate recommendations, then it's a good start. So yeah, that's
perfect. Well, thank you, Zakia. That was very, very informative. Now, before everybody heads off and eats their dinner, I want to share with you our brand new product, which I'm actually really, really excited about. So this product was designed to kind of help children fill the nutrition gap that might be in some diets, whether they're on restricted diets or whether they are fussy eaters. Now it's designed so it's additive free. They are in tiny capsules, and you can easily open them out and sprinkle them onto food, into yogurt or whatever. But also, if the child can swallow, because obviously children as they get older, they start to learn to swallow, they are tiny, tiny capsules. And the other great thing is it's one formula, and you just increase the amount of capsules based on the child's age. So you start with one capsule, and the maximum dose is 3 capsules. And it's suitable for children aged 3 to 16. And obviously it was formulated specifically with children's nutrition in mind. You've got loads of nutrients in there, so 25 active ingredients, including 2 strains of life-friendly bacteria. Now I'll go into the bacteria a little bit in a minute when we get to the slide, but what I will say is if you compare our products to other famous products that claim to be the probiotic companies or whatever, our products actually, our supplement has a higher dose of probiotics in there, plus all the additional nutrients in there. So it is a really good product that supports overall health and well-being and digestive health and just general immunity. Okay, sorry, Zakia, I think there's some background noise coming from your screen. Do you mind just muting it a second? Thank you so much. Perfect. So the first ingredient we've got in there is vitamin A, and that is really important for immune system differentiation. And it's especially important for the gut-associated lymphoid tissue. And in pediatric populations, subclinical deficiencies is increased with an increased susceptibility to respiratory diseases, coughs and colds, gastrointestinal infections, and also it's needed for vision, visual development, and of course the deficiency can cause xeropalathymia. I hope I've said that right. It's a bit of a tongue twister, which is irreversible night damage. So having that vitamin A in there helps to make sure that children have a base level in there. We also have vitamin C in there. And so, as you say, vitamin C is essential for the immune system. And I am a mother, and I know what children do, especially when they're little. They go to nursery, they wipe their nose, they hold hands with the other children, and they play with Play-Doh, or they scratch their bottom, play with the Play-Doh, then the next child eats it. Like, their immune systems need a lot of support. This is what children do. Anybody that is a parent will know that their immune system does need a lot of support. They're always getting coughs and colds. So by adding in that additional vitamin C, you're helping to support that. And of course, some children do have genetic polymorphisms as well, where they need a higher amount of vitamin C than other children. So we've got a good base level in there as well to encourage. Also encourage, things like fruits and vegetables that are and raw vegetables, which are naturally high in vitamin C. But this is just that base level to make sure all bases are covered. Okay, vitamin D is essential. It is one of the ones that's recommended by the NHS, even for babies. And unfortunately, pediatric deficiency is common. We kind of slother our children in sun cream. Some parents are terrified of the sun. As soon as it comes out, that's it, sun cream's going on. And the children aren't getting enough vitamin D through their diet. So unless children are in the sun without sun cream for extended periods of time, obviously you do have to protect the skin as well. Or unless they're eating loads of vitamin D rich foods, which unfortunately most children aren't, it is essential to supplement. And supplementation is especially important in children with recurrent infections, asthma, atopic dermatitis as well. And it is officially recommended by the government. So the UK Department of Health does recommend vitamin D supplementation for all children, even from birth. And then we've got vitamin E in there as well, which is the primary fat-soluble antioxidant within the body that does help to maintain the integrity of the immune function and help to protect the cells from oxidative damage. And lower levels have actually been documented in obese children and those with asthma and chronic rhinitis. And supplementation with vitamin E has been shown to decrease inflammation in the airways of asthmatic children. So it's a really good one to have in there. Okay, we've got the full spectrum of B vitamins. So they are essential for nerve conduction. So they're incorporated into the myelin sheath, which is essential for nerve-to-nerve communication. B vitamins also help to maintain the epithelial barrier. So for example, vitamin B2 helps with the integrity and the mucosal immune system. So when they're getting those coughs and colds or they're being just gross, you're supporting that epithelial barrier and that immune system, the mucosal tissues and the immune system there to help them, that first defense against coughs and colds and other horrible disease bugs and things. Vitamin B3, niacin, also essential for production of ATP. And as we discussed earlier, children do have a higher need for energy because they are learning and developing and growing at such an increased rate. We've got vitamin B6 in there as well, which is also needed for the synthesis of neurotransmitters. So if the vitamin B6 is linked to mood deficiencies linked to mood dysregulation and learning issues. So it's really important to make sure that vitamin B6 levels are reasonably good in children, especially children with behavior problems or children that just get dysregulated or have learning issues. Folate, of course, so that supports nucleotide synthesis and myelin methylation reactions. So methylated folate is the form that we've gone for, and that bypasses the need for synthesis from folic acid into, there's a complex chain of events when you get to folic acid to methylated folate. So some children can't make those conversions effectively. So when you put in the active form of folate, you're giving the body exactly what it needs. So it's a really nice bioavailable form there. And also we've got the methylcobalamin as well, which is the methylated form of vitamin B12 for the same reason. And of course, we know vitamin B12 is essential if you are giving your child a plant-based diet. Then that is an essential one that you do have to supplement with. Or even if your child is an omnivore, but they don't eat much animal products or they don't consume much B12, that is something that you'd want to supplement them with. We've also got iron in there as well. So obviously iron requirements do increase, especially in girls as they get a little bit older, but small children do also need a baseline level of iron. So iron deficiency is the most common deficiency worldwide in school-age children. And low ferritin levels are associated with reduced attention span, lower test scores, and impaired motor development. So this is a baseline of iron that we're giving just to help maintain those minimum levels. Okay, we also have in there zinc. So zinc deficiency, as you know, impairs the immune system, and actually there's so zinc deficiency can increase to reduced growth, diarrhea, loss of appetite, and also delayed cognitive development. So you want to make sure that your child is getting adequate levels of zinc for their brain function and the learning. We also have in there iodine, and iodine is needed, of course, for normal thyroid hormone synthesis and then for neurodevelopment as well. And even a mild deficiency in school-age children is associated with reduced IQ scores. And iodine deficiency, unfortunately, is becoming more common. So that's something that you do want to look out for in children when you have your clients, and also to give them a baseline iodine supplementation as well. Okay, we've also got chromium in there as well, which of course supports glucose homeostasis. And when glucose isn't regulated effectively, that can worsen behavior problems, sleeping problems, and lead to glycemic instability, which could cause a whole host of things. You know, children not concentrating in school, children falling asleep in school, not sleeping at night, being hyperactive. So chromium is a really nice nutrient to give them as a base level to help them with their glycemic control, which supports everything from concentration to learning to energy stability. And we've also got choline in here as well. Now, choline I haven't seen in many nutrition formulations in adequate amount, really. And choline is a precursor for acetylcholine and phosphatidylcholine, again, which is essential for learning and development and memory in children. So if your child is struggling at school, you might want to consider adding in some choline in there. Okay, so we've got selenium as well. And of course, selenium is required for the synthesis of glutathione peroxidase and its activity. And a deficiency in children can put them at increased susceptibility of viral infections and also can impair vaccine response. So if the child is going to be vaccinated, the mother's made that decision, you know, making sure that the child has enough selenium in their diet to support their immune system can actually help to improve the response to that vaccine as well. Okay, so we have probiotics in there, and I'm quite excited about this because actually, if you look at a lot of children's multivitamins, probiotics are missing, and children do need them. There's so many children out there that they call it toddler diarrhea. And it's just a label. It's like, okay, we're not going to do anything about this. It's just your diarrhea. But of course, there's something going on in the gut when your child has toddler diarrhea. It's going to be for another reason, maybe a mismatched microbiome. And we have a really good therapeutic level in here as well. As again, I mentioned, much higher than other formulations that do claim to be, you know, specifically microbiome based. And we've chosen these strains of probiotics specifically for children because they've shown benefits in pediatric populations. So lactobacillus rhamnosus GG has been shown in multiple randomized controlled trials to reduce incidences and duration of antibiotic-associated diarrhea in children by up to 60%. And it also reduces the risk of atopic eczema, which is a high risk in infants when antibiotics are administered. It increases that risk of eczema, but also you want to give, it kind of reduces the risk for eczema when you give it to the mother and the baby when they're very young as well. So it's that first exposure to the microbiome and the pregnancy as well that's really, really important. So it helps to, of course, strengthen the gut, helps reduce any gastrointestinal symptoms, improves immunity and improves digestion as well. And of course, you know, people say you are what you eat, but actually you are what you digest and absorb just as much as what you eat. So that's really important to make sure that digestion is going well. Okay, we also have in there some lactobacillus acidophilus. which is a common commensal species of pediatric bacteria in the pediatric gut, and has demonstrated some efficacy in reducing duration of acute infectious diarrhea, especially when combined with other probiotics as well. So certain probiotics, so certain Acidophilus strains can also support the immune modulation and reduce the risk of respiratory infections in school-age children. And also, don't forget, there are also the studies out there that show that when you give children probiotics, it reduces their number of days that they have off sick from school. And as parents, we all know it can be a complete nightmare when your child's ill and you've got to go to work and then you have to stay home and look after them. It can be very difficult. So if you can reduce those days off sick just by giving them simple probiotic, that helps everyone, helps the child, and it also helps the parents. Okay, so here's the references on the screen here. So you can have a look at those here. If you want to drop me an email, I can also send you those links on there as well. So that's just a bit of further reading if you are interested. We're going to have a quick Q&A. So Zakia, if you put your microphone back on, I've got a few questions for you here, actually. Yeah. Okay, so how long does it generally take to see an improvement in children when you're dealing with pathogenic gut flora? So they've got gut issues, and then how long generally do you want to be keeping them on a high dose probiotic and then moving to a low dose probiotic?
So, I mean, again, it all depends on the state they come in. Usually, as I said before, 3 to 6 months. Just because the gut is a very complex system, and it's not just what they are taking, as you said, the probiotics, but it's also how happy they are to change the diet. Sometimes you have to do a very restrictive diet, so it's combining all these things: the diet with their initial state, and we are all different, we are all born differently, with the microbiome. You did mention that the first exposure, the way we build our guts is through the mother, and how we are birthed. So, and we are all unequal in that. So taking into consideration, how healthy or unhealthy the gut is, 3 to 6 months, and then what are the symptoms better? So do they have less diarrhea? Do they have less bloating? Can they eat more food? Are they putting on weight? Some children, who have got problems, can't put on weight because they're not absorbing, as you rightly say. So 3 to 6 months, and then it's maintenance after that.
Perfect.
I'll just make it quick. I mentioned this before, but Dr. Natasha Campbell, who worked a lot on the gut, and most of you here probably know about her. I will send the link to one of her best books, and she's just amazing, the way she talks about the gut and how everything starts there. So I can also, I'll put that link.
Yeah, no, that will be really good. If you drop me an email with that, and we can send it out to people on the follow-up email. We have another question here from Dee. She was asking what's the best time to take these vitamins without food. So I guess I'll answer that one. So we do say with food, simply because obviously when you've got those digestive juices going, you're going to be able to absorb those fat-soluble nutrients. And those digestive processes are going to just increase the absorption of those nutrients. But what I will say with the probiotics also is we have selected acid-resistant strains. So you don't need to worry that, the probiotics aren't going to be effective if you take the probiotics with food, or you take the capsules with food. You don't need to worry anything about that. But yeah, so take them with food. And I would suggest, with breakfast, if your child's going to be going out to school and going to be having a busy day, so just do it in the morning and get it out of the way. Okay, so Zakia, we have another question here which I think will be suitable for you. What can we do when GPs do blood tests that appear to be within normal range, but the child is still poorly?
That's another often asked. Well, first of all, the range is a wide one. So I think it will be okay for 80-90% of the population, but that child might be in, just about the range. And again, ranges are ranges. If you are very close to the limit, the bottom limit, then you're not going to feel great. or if you're in the upper limit. So ranges are, for most people, what I say to parents when they ask me, I say, don't stick to the range. How is your child? You know your child better than your GP. So a blood test might be okay, and it might show that there is nothing sinister, which is very important for me. You know, most of all, that's what I look when I ask for blood tests. There is nothing sinister there. And then, you know, that's why they come to us to do the extra work. So we go beyond the, you know, the range and make sure we add the extra either supplements, or we do, you know, diet improvement, so the child, you know, gets into the optimum health for them, not what a chart says. It's like size, you know, we are all different. So it's important to listen again to the symptoms and to the child.
Perfect. Thank you so much, Zakia. We've also got another question here from Michaela about asking if the slides are going to be available. We will send you the link to watch this again on demand. So that's definitely something you can do. And of course, you can pause the slides at any point when you're watching it on demand. Okay, so that is all we have time for today. And thank you everyone for your questions.
Thank you.
That does bring us to the end of this webinar. And a special thank you to you, Zakia. You've been absolutely amazing. And I've just learned so much. You're an inspiration. And just a reminder to everyone that we will be sending out the recording of this webinar. And we're also going to be giving you the exclusive opportunity to try our new product, which is the Kids Pro Multi. For absolutely free, and details of how to claim that will be in the follow-up email. But it is only for those that are watching this live, so we can't offer that to everybody who's on demand. It's just for the live attendees only. Okay, so I just want to say also our supplements can be purchased in the Natural Dispensary. So if you are a member of the Natural Dispensary and you use them, please do continue to use them, because they're great. So you can get our supplements from there. And also I just wanted to mention that everyone is also welcome to sign up to the DR.VEGAN Practitioner Scheme. So by signing up, you can lock a huge number of benefits: commissions on sales, clinical news, monthly free products, and practitioner-only perks. We try and make everything as easy as possible for you in clinic. So our product information guides contain all the drug-nutrient interactions. And just we're trying to be really helpful and make clinic really easy. If anybody does have any further questions they think of later on, or maybe watching this on demand, you can email me at ella@drvegan.com. And lastly, I want to say thank you again to Zakia. It's been an honor to have you. And everyone else, please do join our next webinar, which is on the 10th of September on detoxification. So we'll be happy to see you there. Do sign up for that. It'll be very exciting. And Zakia, thank you once again. And
thank you.
Everyone have a great evening.
Thank you. Have a lovely evening, everyone. Thank you. Yay.